Hey there, I'm Rowan and I'm a senior student midwife, and I'm here to talk to you today about moving your body during the postpartum period, um, in the first 6 weeks, that is. So, there's a really classic rule that a lot of midwives and care providers like to encourage, which is the 777 rule, which is 7 days in bed, 7 days around the bed, and 7 days around the house, which puts you just under that. Some people choose to stay home for the first 30 days after giving birth. So, the idea there's a lot of layers to it, but it is so important to rest your body as much as possible. It sometimes it can feel like a long time to not move very much, but your body has gone through an incredible process. And I have this pelvis here to show you a little bit of a visualization of what's happening in this area postpartum. So your pelvis, your uterus inside your pelvis that's attached, has expanded during pregnancy to hold the whole baby and then gone through birth. And it starts this process called involution, where as you nurse and as you have cramps, your uterus starts to return to its normal size that it was around before you became pregnant and gave birth. So when that's, and all of your internal organs that are in your pelvis, but not just in your pelvis, but in your whole abdomen, are returning to their spots that they were in non-pregnant. Okay, so this is a really significant process. And your pelvis and your pelvic floor are not a singular system. They're connected to your diaphragm. There is no pelvic floor without your diaphragm, and vice versa. They're two mechanisms that are directly connected by your abdominal muscles and a lot of other connective tissue to hold all of your internal organs in general, but especially the process of your uterus shrinking and everything returning to their normal place. You have to be very mindful about how you're breathing, how you're moving, and getting enough rest to avoid injuring yourself and actually prolonging the healing process, okay? So, what happens is your diaphragm and your pelvic floor work together as a pump that regulates the pressure inside of your core, okay? So they have a very, very connected relationship. So, if you are one of those people that's really eager to get moving and get exercising early on in the postpartum period, remember that your breath is everything. Any exercises that you do will not help and will likely only hurt you without breathing correctly and helping your body regulate the pressure inside and hold all of the organs that it's holding, okay? So we'll just touch base really quick on what diaphragmatic breathing is, which is relaxing your pelvic floor as it naturally bulges down on your inhale and your diaphragm lengthens, and on your exhale, your diaphragm naturally shrinks and pulls your pelvic floor up, okay? So that just happens naturally, but a lot of us don't consciously breathe that way, so we have to relearn it a little bit, but this is the foundation of what is going to help all of your tissues stay in alignment, stay healthy, avoid injury, and support your healing process. And it's very productive to do this just in bed, okay? So what happens is we want to be in as much of alignment as possible. I'll show you from the side. Sitting on your sit bones, but you can do it in any position that feels best. You can do it, this is a great thing to do while you're nursing. So on your inhale, you're going to see the belly expand. And on the exhale, let that belly pull back in towards your spine. One more time. On the inhale, exhale. You don't need to be in a rush to start doing Kegels, squeezing your pelvic floor on the inhale. You'll get to that later once you get in alignment, okay? So your midwife will help you later down the line, after the first 6 weeks, start doing some core exercises. But the exercises that are appropriate and helpful for every person are going to be different according to the individual and according to your unique needs. I feel strongly through my studies and my experiences with postpartum core and pelvic floor fitness and health and stability that an exercise that might benefit one person, such as Kegels postpartum, might actually hurt somebody else, because we all have very different and complex health issues related to our core and pelvic floor. So make sure that you're working with someone that you trust, asking for more resources. I'll add some more resources at the bottom of this assignment here for you to utilize. And so yeah, diaphragmatic breathing, 7 days in bed, meaning you're laying down, you're nursing, you're in bed. You've got all your beverages next to you. This is ideal. You're getting up to use the restroom every once in a while. 7 days around the bed, meaning maybe you're sitting up a little bit more. Maybe you're just doing simple tasks around your bedroom, but not much. And then 7 days around your house. Now, throughout all of this time period, you do want to ideally avoid like walking up and down stairs, because that creates a lot of pelvic and core instability. I know that that's not possible for everyone if you don't necessarily have a support person with you all the time that can do the trips up and down the stairs to get you what you need. But ideally, you're avoiding the stairs, and we're preparing for this prenatally to get you the help, whether it's a volunteer doula, somebody if you need reinforcement for a support person to help you with these tasks and support your body healing, okay? It's very common in the society and in the culture that we live in to be rushed to get back to work and to uphold a lot of the responsibilities of the household and our families, but it is, think about your core in a lot of different ways. Physically, your core, emotionally, your core, spiritually, your core is a huge priority through this postpartum period. And the 777 rule is also very helpful in prioritizing you bonding with your baby and having the time and the space to gently transition into this relationship. Having that 7 days of just being in bed with your baby, skin to skin, having people bring the nourishment to you that you need. The rest is so important. And you can do your breathing, your diaphragmatic breathing in bed, which is very helpful and very productive. And that's something that you want to try to keep with you through life. Because once you have your baby, really, you're postpartum forever. And this first few weeks is going to set you up for what the type of healing process that you have all throughout the many months and years to come. So I hope this was helpful, and I hope that it encourages you to prioritize your rest and your wellness. And thank you so much for listening.